you, like Dr. Rao said, there is an important responsibility that citizens also have here, because we need mass vaccination, but we also need to open up the economy. How is it that India is now faring versus others also needs to be seen here, Dr. Vyas. When 1.8% of the total population of India has been affected, but the infection is to under 2% of the population, how is India the story of doom if we actually consider and we actually mark out India has administered 13.32 vaccines per 100 people, and countries like Australia have administered 12.14 vaccines per 100 people.
Yeah. So all of my friends, they have majority of the question has been answered by them. I would like to answer your question in this way. Like we have to, because I'm not an economist, I'm a doctor, or I'm a physician by profession, I'm a surgeon by profession. So it is very difficult for me to say that when to open the economy and what to close it down. But at the moment of time when India is facing through this second big wave, what we are supposed to do and what results we have seen is only because we have paused a button, and which is known as lockdown. And because of the lockdown, we are getting a good amount of results, good results, especially in the urban area. That's what Dr. Soin also told. But what has happened is that majority of these districts actually, if you see one by one, and if you see that the infectivity rate in majority of these districts are a little bit on a higher side. Still, somewhere it is 20%, somewhere it is 30%, and few of the districts it is still 40%. So as an clinician, what I feel is that till our infectivity rate doesn't come down in a single digit or maybe less than that, then till then time we have to keep the lockdown in such a way that meanwhile we can keep on opening a little bit of our economy. Thereby the people, poor people especially, who can earn their bread and butter, and simultaneously we can keep on checking the data actually. Simultaneously, we have to keep on doing vaccination amongst our young and old people. And as you have pointed out rightly, first when you started your conversation, during that time you raised a question about how we are going to fight the second or third wave. We are not worried about third wave as a whole, as in clinicians, because we are worried at this moment of time about the second wave, because it's a more virulent type of virus, as everybody knows. And it is affecting not only the adults, but it is also affecting the kids also in India. And even though my colleague from Mumbai, he will also agree upon that in even Mumbai also there are many patients, kids especially between 2 years and 17 years, they're getting affected by coronavirus. So we have to see in triple ways. You can say standard remains that infrastructure needs to be further strengthened, especially for pediatric age group. Simultaneously, we have to keep on doing vaccination. And we have to keep on lockdown also, because if we'll suddenly open it up, and what will happen is again the cases or percentile of infectivity rate will further go up. So we do not want that, and for that these three measures should be enough, I probably feel. Continue the lockdown for some more time, keep on doing vaccination program, running vaccination program, and to protect our kids, the better thing will be that both the parents should get vaccinated. And I think probably 80 to 70%, 80 to 90% of our kids can get protected, because if both the parents takes a vaccination, then probably we can protect our kids also. And meanwhile, our Ministry of Health and Family Welfare is already allowed the co-vaccine further to test it between 2 years and between 16 years. Results will finally come out in the month of November. During that time, I probably feel it will be a safe vaccine for even kids also. So these 3 or 4 months are very important for us, especially for protecting our society and continuing doing a good work what we are doing right now. And one more aspect which is there, and majority of us will agree upon, we don't know about what is happening in villages, because not many testings are taking place in villages. So for that also the government has to come out with some ideas, and we have to do a test even in villages, and vaccination program also needs to be started, because there's a divide for even amongst the vaccination program also. The urban area vaccination program is for urban people. In urban area the vaccination has gone into many times, but look at villages we don't have any data, or very minuscule amount of people are getting vaccinated. So this divide should not happen. I probably feel both the areas to be simultaneously vaccinated, and we have to keep on testing even villagers also, and we have to keep on educating. I know majority of them are uneducated people, may not be knowing about the severity of this disease, but we have to protect our village people also, because as we know that 60% of our population lies in the villages. So that is a major chunk also. Apart from urban area, we have to protect our villagers also.
Yes, Dr. Vyas has very crucially spoken about, viewers, the villages and the rural vaccination that has to take place. Dr. Parker has clearly said that it is the doctors who need to be in control when it comes to giving medicines, because they would know independently